3,900 doses of the Johnson & Johnson vaccines have been delivered to the Northwest Province, and 2 vaccination sites have been identified for this first phase of vaccination here in the province. And those sites are one hospital here in Rustenburg and one in Klerksdorp. Now, to hear more about this, we are joined by the MEC of Health in Northwest, Mr. Madoda Sambata. MEC, thank you very much for making time to speak with us. Please do talk us through the kind of rollout plan that you have as the province.
Thank you very much. We are dealing with 3 phases. Phase 1, it's health care workers across the province, private and public. And then an addition of traditional health practitioners in that category. They are first group. The second group, which is phase 2, deals with people above 60, with people with comorbidities, then deals with the extra population comes in. The third one deals with population extended. Provincially, we need to vaccinate 2.7 million people of the province. That 2.7 million gives us 67%. If we use Johnson & Johnson because it's one dose, it has no follow-up to be taken. If we use Johnson & Johnson, hypothetically we're going to use 2.7. But because no country uses one, there's a combination of what you get and what you receive at any given time. What we will receive then by that time would administer as per its requirement. But for now, let's deal with what we've received. We've received 3.9. It's Job, Shimankane, Tabane, and Klerksdorp, Tshepang. These ones of Johnson & Johnson arrives in a break of 2 weeks. So 2 weeks supply, it's 3.9, and it's enough for this period. And then the next 2 weeks arrives, it's enough, and then we do all health care workers. They must be done not above 3 months. We must use a minimum of 3 months to do all of them. Then we go to phase 2 and phase 3. But the requirement is people per phases must register. So health care workers, all of them should have been registered by now, because we're starting tomorrow. And they are going to receive in their phones their date, their time. It's not a wake up and go to vaccine site. You register, you then receive a date and your time and a place. Then you go, because we have been confirmed to do that. Tomorrow we're starting with the ones that are going to be confirmed to be ready by tomorrow. We do them. As we do them, it's going to increase. But we must mobilize South Africans that now that the process of vaccination has started, it's one element of prevention. We still insist. Prevention measures, mask, social distance, washing hands, sanitizing, still to be done, because if by today you are risky and then you get transmission and you are confirmed tomorrow to be COVID positive, tomorrow you are not a candidate for vaccination. We don't vaccinate people who are confirmed with COVID active. They go through the management of COVID, then they recover. That's later, then they become part of the category. That's why you must keep ourselves live for our day to come. It will come finally, because vaccination has finally arrived.
Okay, and please do tell us about the number of vaccination sites that we have here in the province on the public health system or service side and the private sector.
Provincially, we have 26 public sites and 17 private sites. The 17 private sites still receives allocation of vaccines from the provincial government, because we are registered as a province, not private and public. The number we have submitted to national includes private facilities. 17 sites and 26 sites. We will then do an outreach program when we arrive at more of a population access closer to the people.
And you've been visiting some of these vaccination sites. Just briefly talk us through the kind of preparedness that they have.
The site we are at currently, it's a site I visited last week. And the reason I visited all the sites is to ensure that they are ready so that we don't have an administrative nightmare, that we have vaccines that have arrived. They must be distributed to a site. The site is not ready because it is in the site where actual vaccination is going to be done. The less logistical nightmares in a site, the success the vaccination program is going to be. And I'm happy that our province is ready. We visited. Even those that were not ready, we did adjustment at the time we arrived, and working with everyone in the province to ensure that no vaccination site must not be ready on the day of vaccination.
Thank you very much, MEC, for making time to speak with us. Mr. Madoda Sambata is the MEC of Health here in the Northwest Province